Hashimoto's thyroiditis is the most common cause of primary hypothyroidism. So if you see like weight gain, constipation, fatigue, and then maybe like a diffuse goiter, then you can think of this autoimmune disease. Especially in women, has a peak incidence of like 45 to 65 in females. Most common hypothyroidism in iodine sufficient countries like the United States. And so in all forms of hypothyroidism, you're going to see low T4 and also elevated TSH. So you have your antithyroid-peroxidase antibodies. Those guys are going to be elevated. Now, note that it's not specific, so you could also see them in like postpartum or Graves, your antithyroid-peroxidase antibodies. But you can just do a biopsy if you want, and you'll see the lymphoplasmacytic infiltrates, often with germinal centers, is what you're going to see. You can also see those Hürthle cells. So like they're really like large cells with granular eosinophilic cytoplasms. So fatigue, weight gain, here are the labs that you'd see. And yep, your Hürthle cells, eosinophilic, risk of non-Hodgkin's lymphoma. Practice question, 49-year-old woman has fatigue and cold intolerance, diffusely enlarged. Labs show elevated TSH, low, free T4, and also these antibodies. A fine needle aspiration would reveal what? This can be lymphoid aggregates in germinal centers. So here are the trap answers. Branching, that's papillary. So the branching papillae and semoma is going to be papillary thyroid associated with orphan eyes. Extensive stromal fibrosis is Riedell's. So woody, fixed, rare. Follicular hypoplasia, that's going to be Graves. That's hyperthyroid. So remember that hyperplasia in the scalvocolloid, Graves. Granulomatous inflammation, subacute aquarium. It's going to be painful and post-viral. So yeah, Hashi is going to present with your hypothyroid, painless goiter, unlike aquarium. They're going to have your germinal centers and Hürthle cells, which are large granular eosinophilic folliculars. So it's just due to your chronic immune destruction of your thyroid. And this is what you should be thinking of when you have sufficient iodine. So yeah, sufficient iodine, regions, hypothyroidism, painless goiter, autoimmune problems. It's going to be lymphoplasmacytic infiltrate. If this is helpful, then like and subscribe.